Talofa, Aloha, Afade, Ali, Yahweh, Rananim, Kasalelia, Malo Lele, Malo Aupito, and to all of our sisters and brothers from the Pacific region, to health leaders from American Samoa, Guam, Northern Marianas, Palau, FSM, and the Marshall Islands, as well as other attendees. It's an honor to greet you. To PIHOA, thank you for inviting me to speak. I wanted to talk briefly about health in our region. The territories and freely associated states are diverse, scattered across thousands of miles of ocean, but in many ways we're similar. We are Pacific Islanders, and we hold a special relationship with the United States government. With a new administration, it's important to communicate with them what our priorities are. Each health jurisdiction is at a different place in addressing the challenges you face in delivering care. Like our outriggers crossing the sea, we are getting there at different paces, using different methods. This is why, instead of a one-size-fits-all program, we must replace that approach by jurisdiction-led, individualized programs. My Pacific Healthcare Initiative strives to make available what each jurisdiction needs while improving overall health care in our region. PHCI calls for strengthening mainland medical and nursing school partnerships with you and improving health infrastructure, including the development of specialty care centers in the islands. This will require funding, but that is the job of Congress, to look for where those funds can come from. It is certainly not easy, and getting this initiative, even part of it, across the line will require all of us working together. In the 1998 Institute of Medicine report on health in the U.S. API, the authors recommended the establishment of two agencies, a U.S. Governmental Committee on Pacific Health and a Pacific Basin Health Coordinating Council. I believe this approach is needed today. Bringing together a U.S. committee focused on Pacific Health and Pacific Basin Health Council would facilitate outlining health challenges, ways to address them, and reporting on the progress or difficulties individual health systems have. I believe this approach will help facilitate more effective United States-sponsored regional health development programs. It can also serve as a platform for non-government organizations to engage with us. Our voice must be strong and unified. I say this because I am with you on this. You already have all of the ingredients to create a Pacific Basin Health Council. ASTHO, with its strong advocacy and public health support, PIHOA with its regional voice on health issues of significance, other health capacity building organizations, the territory and freely associated states health representatives, and Pacific Island U.S. representatives and friends in Congress. Pulling all of us together will strengthen our voice. The current administration is focused on efficiency, reducing spending, and the redundancy of agencies. This could be beneficial to you, as there are at least 10 different agencies you currently obtain funding and grants from. Advocating for one clearinghouse for grants and funding will reduce your reporting regulations. It is efficient as well, and the President will like that. Another is to advocate for programs that are tailored to the needs and challenges of the region. The Department of Health and Human Services just announced they will reduce the number of regional offices from 10 into 4. We don't want Pacific health needs being lost in a crowded regional office. just as the Indian Health Service has its own bureau. So too should the Pacific Islands. We are not California or Arizona. Our people face serious health threats from chronic diseases layered on top of infectious diseases, injuries and accidents, as well as behavioral and mental health challenges. As health leaders, you know this all too well. Providing health care, health education, and prevention in our islands requires that our U.S. partners recognize the importance of delivering health care to small populations living on remote islands with hundreds of miles of oceans between them. This is what our collective mission should be, and I'm happy to work with you on this and stay in contact. Thank you, and when you're in D.C., my office is always open to you. Soifua Maia Manuia.